Adductor longus and adductor brevis are deep to the gracilis. And so I will often treat the gracilis first to try to soften that up a little bit, and then work into adductor longus and brevis once the gracilis has been softened. And so here you can see I'm kind of just compressing along the line of gracilis. And then our adductor longus and brevis points are going to be, again, just off that gracilis tendon. And sometimes I might even work through gracilis because everyone's anatomy is just very slightly different. Okay, so longus and brevis, I kind of want to get, like here I can feel there's a thickness of gracilis tendon, and I want to go just off of it. I'm almost even catching a little lip of it. And how about there's that tender there?
It's very tender.
Very tender. Okay. I can back out a little bit. Does that feel better? Mm-hmm. And so, you know, these little deeper muscles, it's very hard to warm them up well. So treating the other tissues around, the more superficial tissues and all the warming that you do for those really helps to prepare the body for these deeper places. And how about that? Is that feeling better?
Mm-hmm.
Okay. Mm-hmm. I'm going to pull out one thumb. And then I tend to just explore around here. It's very difficult to know where exactly is adductor brevis, where exactly is adductor longus in this scheme of things. Here's our gracilis. We know sartorius is coming down along here. So I just move just a tiny bit up toward the pelvis, and I'm going to sink in there a little more deeply. Nope. Yep. Tender there? Very tender. Oh. And so I'm going to spin around so I have a supported thumb. And I'm sinking in there. Mm-hmm. And can you take a nice breath in your belly? How's that feeling? Any better?
Yeah.
A little easier. So just a reminder, you can hold the points for between, 7 or 10 seconds up to a minute and a half or so. And then doing some soothing in between. So there's adductor longus and brevis with the client supine. I typically work these muscles with the client side lying. But sometimes you just got to get some work done and not have as much time don't have a lot of time to have the client shifting face up, face down, side lying positions all the time. Okay. And so there's our adductor longus and brevis. And now we're going to do that work on the other side. Doing some more warming and softening. So again, the anatomy here is, it's a little difficult to know exactly where the different muscles lie. Pectineus is such a little small muscle. It goes almost horizontally, right, from the pubic bone over to the femur. And then adductor brevis is a little bit more angle, and adductor longus a little bit more angle from about the same area. So we find our gracilis tendon and then deep in here, right at the pubic bone, right in that femoral triangle, was our pectineus. So we're going to go just below that area, right off that gracilis tendon. And the first point we come to would be adductor brevis, because it's the shorter one, right near that pectineus. See if I can shift my thumb. So I have a supported thumb, and I'm angling it in, straighten my arm, and then just lean my body weight forward. And that's right there, yeah? Right? Tender. Yes. Super tender. Do you need me to back up a little bit? A little bit. Okay, thank you. You can always say less right away. I really want to encourage my clients to keep in good communication, especially these muscles. Most clients haven't had this work so specifically in the adductors before. Adductor brevis, that feeling a little bit better? Great. And so we're going to slide out, and then we just go down just a little bit, still right off that, pick up that kind of gracilis tendon, move right off of it, and sink in. And how about there? Is that tender also? Yes. And does that pressure feel right for you? Okay. Just take a few breaths here. Because these points tend to be pretty intense, I just like to do a little nice soothing around the area. Nervous system could use a little support at this time. And is that feeling better? Yeah, great. Okay. Okay. Nice soothing. Okay, and that's treating adductor longus and brevis with the client supine.